In Kenya, the doctor-to-patient ratio in the public sector is estimated at 1 to 17,000 compared to the WHO recommended minimum of 1 to 1,000. About half of the doctors work in the urban centers, leaving out the rural areas where the majority of Kenyans live. This has been the case in Mathioya Health Center, one of the few hospitals in Murang'a County with a few doctors to cater for the many patients. Fixing this gap will be a process, but such are the traditional problems that technology could fix much faster by using unique 21st century solutions such as telemedicine, as practiced in Kenya by Daktari Africa through the Digital Hypertension and Diabetes Clinic. Dr. Charles Kamotho has been at the center of this clinical revolution since the year 2008.
So Daktari Africa is a telemedicine platform that connects patients to doctors. We want to connect all those people in Kenya and beyond to healthcare providers who are able to look after them in a manner that is easy and convenient and efficient to both parties.
In 2018, Dr. Kamotho piloted the digital medical outpatient clinic that has been operational in the remote Mathioya locality. And now, Daktari Africa offers patients access to audiovisual tele-consultation on their secure platform, bridging the gaps of distance where a doctor is not able to be on site. They have also been able to facilitate e-prescriptions, offering affordable medicine to their patients.
Cosmos felt it fit to partner with Daktari Africa, which is an innovative digital platform that promotes telemedicine and now going on to promote online CME. For instance, the CME that we had in Nyakianga, which is a very rural area where patients get challenges in accessing quality healthcare. So Daktari Africa being able to provide this educational service to them online is an added value, and for Cosmos we plug in because we do provide affordable medicines to these patients by partnering with Daktari Africa.
And I think
to make the online platform more efficient, Daktari Africa organizes continuous medical education, CMEs, to frontline healthcare providers, offering them a unique opportunity to expand their knowledge in the basics of medicine, including the management of various diseases and conditions.
Through Daktari Africa, I was invited to give a CME session, that's a continuous medical education sessions, to a group of clinical officers and nurses and other medics in a county facility in Murang'a. So what we did this morning is that we used the Daktari Africa platform to actually deliver a CME fully over the internet, what we call a webinar. Yeah? So I was seated here in the office in Nairobi, and the audience was seated in Murang'a County, and we were able to interact, and I was able to actually give a CME session to the medics there.
We had a very nice session that really helped, especially me being a clinician. It reminded me a lot about diabetes, and we would like to have more CMEs every other time. Not once in a while, but frequently, that will help us in better management of the patients.
The knowledge is cascading right down to the grassroots with the training for remote community healthcare providers.
Daktari Africa is a very good platform, especially they have actually started synthesizing the community health frontiers, the community health extension workers, and it's a very good platform whereby early diagnosis of various conditions can be identified, and early treatment and even prevention, which is better than cure. So I actually echo the Daktari Africa is a very good platform for the community and up to the household level.
All these helps in more efficient use of human resources and puts Kenya faster on the track to achieving universal health coverage and universal health care as per Kenya's development agenda, as well as the UN Sustainable Development Goal number 3, which is to ensure healthy lives and promote well-being for all at all ages.
Healthcare is actually a relationship between patient and healthcare provider. And that relationship implies communication. When a doctor is to carry out a consultation or to make a diagnosis, he needs to be able to talk to the patients. He needs to be able to understand what their symptoms are, what they're complaining of, where they're in pain, what medications they use, their medical background. And therefore, it is important for him to be able to talk to the patients and the patients to give a complete history to the doctor.
Over 70 patients have been able to receive consultant expertise, with about 30 or so having been referred on time for further services. We feel that this is a model that should be applied to as many sub-counties within our county as possible, because we don't have enough consultants to be able to come on the ground and support the other healthcare workers with early diagnoses. And so having this connection gives that platform and chance to capture patients early and prevent complications of, for example, diabetes.
Telemedicine by Daktari Africa is an example of access to quality healthcare and up-to-date health information. And while Kenya has embarked on a noble journey of achieving universal health coverage by scaling up NHIF uptake, Daktari Africa is a sure way of achieving its target for universal health care.